Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real life patients about all things plastic surgery. Should be fun. Hi.
Hi. Yay. Oh my God. I love your setup.
Oh, thank you. It's my office. It's fun in here. My kids like being in here with me.
Cute. I love it.
Thank you. I'm super excited to have you on. I know this is going to be so much fun. I just saw you were in Austin.
So I'm in fellowship right now at Aesthetic Center for Plastic Surgery in Houston. And our director is awesome, Dr. Morales, and they set it up to where we have like the ability to go do elective time. So I basically can choose any surgeon in the country. And Dr. Gordon is just like this badass female boss plastic surgeon. Not the fact that she's a female, but like she's just an incredible person and does some techniques she learned from her mentors that are not super common. And it's, plastic surgery is so trend dependent. And there's certain surgeries that we have like really great long lasting results. And then there's surgeries where we have like 10 different ways of doing it. So I wanted to go learn her technique for how to do a specific surgery. And I had the best time with her ever.
That's awesome. So does she focus on face? Is it face?
No, she's really heavy on breasts and body.
Oh, okay.
Yeah.
Cool.
Yeah. And
Awesome.
then she's in practice with a partner and he does most of the face of the practice. So they have like a really awesome split with one another.
So, you know what I think would be really cool for us to talk about would be like how, because I get asked all the time, is it okay to go to like, for example, ACPS, how they have the resident program, like how for women who are considering it, I think it would be really interesting for you to tell us even what it is that you're doing during this time in training.
Sure. Awesome. So the way that the medical training works, in particular plastic surgery. So I finished my 4 years of medical school and I completed plastic surgery residency, the new route that you can become a plastic surgeon. And it's very, very competitive. And it's only been around for like the past 20 or so years. Is you don't have to do 5 years of general surgery anymore. If you're a very strong candidate, they now have programs where it's 6 straight years of plastic surgery. So I completed that training and now I'm in my 1 year of fellowship, which is an optional year. So if I didn't choose to do this year, I would be out in the community practicing on my own. But the market has become so competitive and where I knew I wanted to practice, no one was fellowship trained. So when COVID happened, I kind of started to analyze, what city do I want to establish myself in? Where do I want to practice? And what can I do to set myself apart? And so that was really my decision for wanting to do an aesthetic surgery fellowship, was because I knew I wanted to penetrate the Tampa St. Pete market area. And there were no fellowship trained surgeons. So I needed to do that to put me kind of a foot forward for my competition. And there's wonderful surgeons there. And a lot of them are like my mentors, but I needed to do something that made me marketable.
Stand out, right? Something that makes you stand out. Well, I think being a female already is a good starting point.
It's so variable on where you practice demographically. I think there are certain cities and states, and obviously some patients really have a strong preference for female, but there is still a disparity, I think, in medicine and particular surgery. But I think we're getting away from that idea that a surgeon needs to be a male. I think now the average, it used to be male dominated field. And I think for the first time in history, we're now getting more female plastic surgeons, which is really exciting to be a part of this change in history.
I love it.
I'm here for it.
Yeah, I'm here for it. I'm so hyped about it. I love my male plastic surgeons. They do their thing. But my female plastic surgeons, I feel like there's just a little bit more detail there's just a little bit more attention, a little different because you see it differently because you have it on your
Correct.
own body. And
Correct.
I've seen it. I've seen female plastic surgeons do amazing things. And I'm like, dang, how did you do that?
I know. I agree. I think the male surgeons are wonderful. I think this is one particular subspecialty where being a female is just that much more of an ability with your patient to connect with you as well, because we have the same body parts. We kind of know what women desire.
They're experiencing, like through pregnancy, through breastfeeding, through vaginal
Correct.
birth, vaginal
Correct.
deliveries, like all of these things that men don't experience. Period.
Correct. 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 So that it's awesome. But so the services we offer through our fellowship, in order to make it appealing for someone in the community to come to someone who's technically still in training, it's kind of like the perfect secret though, because I'm technically done with my required training. And so I'm just here refining kind of like specific details in aesthetic surgery. And I get to do that offering patients slightly lower cost than the competition. So it's
And
an awesome opportunity.
and you're also with like some really great surgeons kind of with you in
Incredible surgeons.
in your
Yes.
back pocket.
Yes. Yes. They're not, standing above us in the OR hovering, but if we ever have a question, they're like readily available. And we discuss our cases beforehand. So before I go in surgery, I've talked about my case with at least two, three of them and gotten kind of their input, their advice. How would they tackle this case? And that mentorship is for a lifetime. So for me, it was a no brainer to dedicate this one extra year to training because
Yeah,
you gain so much more than just the surgical experience. You really make connections and friendships and mentorships.
I love
And
it. So
I'm super grateful.
you're doing amazing. I
Oh,
I saw you hit the Instagram running and I was like, I'm here for it. Get it,
oh my
girl.
God. It was hard. So I credit Dr. Morales because he really, when I came here for fellowship, my Instagram was deactivated. So Surgery and Stilettos, I started it in 2014. It was like the era when all these fashion bloggers were blowing up, like scrapbook style scrapbook, Dolce Candy, the blonde salad Chiara Ferragni. I like really idolized these women who was just like, well, I mean, they've got this awesome career, but it was very much like what you're wearing, what handbag you own. And so I started Surgery and Stilettos because I wanted, truthfully, my younger cousins to be like, oh, being educated is empowering and beautiful. It's not like the clothes you wear, it's not like what you do. It's like following your dreams. If it is getting educated, great. For me, that's what it was. And everything else kind of all the pieces fall together after that. So that was the concept of Surgery and Stilettos because I loved the fashion and style industry, but I also loved medicine. And so I wanted to be able to display the best of both worlds and start a blog. But I'm such a private person that I never launched the blog. Well, also medical school was like, drinking out of a fire hydrant. But it never amounted to anything because I was A, scared, I felt vulnerable. And B, I was like, well, who's going to care about my voice? Like, I'm a medical student. Fast forward like 8 years later, and Dr. Malice is like, you need to reactivate your Instagram. And so I did, and I started putting myself out there. And there's a lot of negativity. I'm sure you come across it that you get in social media and putting yourself out there. But the bulk of what I get out of it is still positive. And so I'm having fun with it, but it's a work in progress.
A roller coaster. It's
It
definitely a roller coaster.
It is. I have good days and like the burnout is real. And I think digital addiction is real. And at the end of the day, I'm a surgeon and I am having fun with being able to display my personality on Instagram, but I also don't want to let that take away from my patients and the care I provide. All the surgeons here, they have marketing girls that run their accounts with them for the most part. So it saves them like a lot of the background time it takes for like making reels, making posts, but I do it all myself because I want people to know my personality. So I'm doing my best with
You're
it.
doing so good. I'm so proud of
Thanks.
you. You're
Thank
you're
you.
hitting it.
Girl, I am so annoyed with them though because they shadow banned me because they're now shadow banning surgeons that post their before and afters. So I had to erase all my before and afters. So I'm going retro, old school. I'm gonna launch my website that's gonna have all my results. And my Instagram's gonna be like my personality and more of like the day-to-day behind the scenes of like
Mhm.
what my life in particular is as a plastic surgeon.
I love it. I
Thanks.
know that the girls, your patients, potential patients for any plastic surgeon, they love seeing the before and after. So it sucks that Instagram is not going to let them on there anymore. But definitely having your website linked and for patients to go look on your website to find your pictures, that's going to be awesome. But on Instagram, it's a really nice way for patients to get to know you, your
Right.
judgment, like why you make certain calls, or, they just like to get to know you because you're going to cut them open. They want to
Correct.
know who you
Correct.
are, what's your personality, what are your beliefs. They want to know everything about you. So the more you can show, the better.
Correct. Oh,
So,
thank you.
the episode for today, I'm super excited about it. We're talking about alcohol and surgery. Well, alcohol, nicotine, THC. Okay, so Dr. Abbasi, why don't you tell us, for a patient who's planning to have their plastic surgery, how long before surgery should they stop drinking alcohol? What does alcohol do to them? And when can they resume drinking?
Okay, so alcohol, if you don't already know, it's metabolized by your liver, and the liver is a very powerful organ. It's also responsible for producing the clotting factors that help bleeding stop. So, in surgery, when you create a fresh surgical wound, your body processes that injury instantaneously. And there are certain cells that start secreting these growth factors and signals. And what it does is it stimulates your body to build this kind of mountain where the blood vessels have been cut and it stops. So it clots off that blood vessel that was bleeding. So, alcohol, because it's processed by the liver, it's hepatotoxic. So, what it does is it slows down your liver's ability to make those clotting factors. So while we don't have like a perfect timeline, it's not as clear cut as like nicotine. The liver produces these clotting factors on a very regular basis, on a daily, weekly basis. So I think a safe point to stop drinking would be 1 week before surgery. And the reason your surgeon wants you to stop is because you may bleed excessively after surgery if you are consuming alcohol heavily. Same thing for after surgery. The most common timeline, if you were to have a spontaneous bleed, when you have a bleed after surgery, it creates a collection of blood. That's called a hematoma. So for us, it can be a surgical emergency if it's actively bleeding, but a lot of times it's a controlled amount of blood that is released because your body wasn't effectively able to clot off that blood vessel. So if you were to have a bleed, it would most commonly happen within 24 to 72 hours after surgery. I'm not saying it can't happen further out from surgery. We do see it a week after surgery. And often that's because patients start feeling really good and they overexert themselves, causes your blood pressure to go up. And then that tiny little clot that your body made perfectly kind of busts open. So I think it's safe to refrain from alcohol for 1 week prior to surgery and at least 1 week after surgery.
I'm going to go on to say that maybe even longer after surgery for you to lay off the alcohol, just because let me tell y'all my personal experience of having surgery and then going, I think it was like maybe 2 or 3 weeks, that this was before when I would drink socially. I went out and I had a night out with my girlfriends, and the swelling was intense for, I don't know, I'm going to say like 3 weeks, where my body just could not get rid of my swelling. It took me forever. And it was a really intense night out after my surgery and going out with my friends and having so much fun. And then immediate regret the next day.
Oh, absolutely, absolutely. And we know that when we drink, we're not getting adequate nutrients through our diet, and it starts compromising your body's ability to heal. But absolutely, absolutely.
I think the most important substance, actually, more than alcohol, we know we're just not supposed to drink around surgery, but nicotine. Nicotine is something that, I mean, in the Facebook groups, I see
Mm.
it so often where women are like, oh, what if I just stop like 3 days before surgery or 4 days before surgery? I have seen this. How can I pass my nicotine urine test if I still smoked a couple days ago? They're trying to figure it out. How can I pass this test? When in reality, what I want to say is like, do not even try to fool the test because the person who's really risking it is you. It's not your
Correct.
surgeon who's, I mean, your surgeon's not going to be dealing with the complication on themselves. They're going to be dealing with the complication on you. So by smoking, you're really putting yourself in a bad spot for after surgery. So why don't you tell us a little bit about nicotine and what it can do to our incisions?
Correct. Okay, so nicotine triggers every surgeon. And if it doesn't, you should find another surgeon because it is the number one piece of information that we have to be 100% transparent as a patient and as a surgeon why it's so important. So, nicotine, similar to alcohol, it causes dysfunction of specific cells called platelets. The platelets are the first cells that clot off a blood vessel or clot off an injury in a wound. It causes dysfunction of these cells. So your body doesn't secrete those cell signals that say, hey, I'm injured, bring the healing cells to me. So the nicotine is directly stopping your body from being able to A, know that you had an injury, and B, be able to repair it. As a patient, I just can't even stress like how dangerous that is. If you are actively smoking prior to surgery, your incisions will break open. It may not if you're like a very young, healthy individual. Yes, you might get lucky, but for the majority of people, if you smoke and have surgery, you are going to have 99% nine chance of having a complication, whether it's an infection, whether it's having your incisions break down. And I've seen whole tummy tuck incisions break down because patients lie. They want the surgery so bad that they're willing to lie to their surgeon. But we don't have these rules in place because we're trying to be mean or limit patients from being able to get surgeries they want. We have them in place because we want to protect you. We take a Hippocratic oath to do no harm. These rules are in place because we know if we operate on you as you're actively smoking, we're knowing that we're putting you in harm. That's not okay, and no surgeon should be okay with that. We have patients that have gotten really creative on how to get around the nicotine test. We have ability to test it in your blood and in your urine, and it's a very easy test that we could surprise you with on the morning of surgery, and we often do it. We've caught patients trying to use other people's urine, and it's just disappointing. And all I can say is I really respect the surgeon that when they catch a patient in that act, they have the right to fire you as a patient. And it's not being mean or cruel as a surgeon. It's pointing out that as a patient, you're being really inconsiderate and selfish of all of the medical staff, of the surgeon's time, and you've taken another patient's opportunity for that day and time of surgery. That's really rude and selfish as a patient. And I'm not trying to bash, but like as a patient, you also need to reflect that that's not okay to like take that away from someone else. And so I would hope that as an individual, you would feel that you're right. Like that's a devastating consequence, and my surgeon's protecting me. And it's not fair that I took another patient's surgery slot because a lot of these surgeons are very busy and we love operating. So having to cancel a surgery on the morning of surgery is devastating for everyone.
Especially
But
when
it,
patients have been waiting for months and months and months, which most of the time they've been waiting for over 3 months to have surgery.
yes, yes. And it's not fair. It's not fair to anyone involved. It goes so much farther than just you as the patient, right? But nicotine, so it causes dysfunction of cells that specifically stop your body's ability to heal. It takes about 4 weeks for the nicotine to get out of your system. So 4 weeks before surgery and at least 4 weeks after surgery is where we tell patients we want you to refrain. If you can wait 6 weeks, perfect, because at 6 weeks, your body has accomplished about 85% of the healing it would obtain. But nicotine is just so much more harmful than any other substance. I mean, with alcohol, yes, you get a little bit more bleeding in surgery, higher risk of bleeding after surgery, but wound healing problems is devastating. And as plastic surgeons, we're wound healing experts. That's what our specialty is known for. I know, like in the industry, we're known as these, cosmetic aesthetic surgeons, but in training, we are like wound healers. Like that is what our profession is. And so we don't take this topic lightly at all.
I
I'm
cannot
like very
believe.
passionate. I
Yeah,
know.
I cannot believe y'all caught somebody using somebody else's urine. I'm not surprised. I'm not surprised because I've seen the Facebook group conversations where they're like, how can I pass my piss test, my urine test for my surgery in 2 days? And I just had a cigarette. I know that they're out there and they're trying to figure out a way to cheat the system. And that's why I thought this episode was so important because they don't really comprehend why. It's not like your surgeon doesn't want to do your surgery or you're the only one taking on the consequence, because that's like what I can hear from the patient. Well, it's like my body, like I'm the one taking on the responsibility of like whatever, but it's not really like that at all. It's not like that at all. You're not the only one taking on the responsibility. It's your surgeon taking on the responsibility. And it's like this, just quit smoking. Just period.
I
Quit
know.
smoking. It's not worth your
I know.
tummy tuck incision. It's not worth your breast incisions. It's not worth your
No,
rhinoplasty, like your facelift. None of it is worth going
no.
through surgery with the possibility of having wound healing issues.
100%. 100%. And, the surgeries are not cheap, right? And so you want to optimize your body going into it. And that's all we're trying to do as surgeons is help our patients see that and register that. And I understand, the nicotine addiction is real. I know that substance abuse is a problem and I know it's difficult to quit the habit. But if you're unwilling to even take the steps towards recovering and refraining from it, then you shouldn't be in a position to put your body through such a stressful situation, such as cosmetic surgery.
Like a full tummy tuck surgery, you guys, you have to get your body in working full, like greatest capacity, running on
Yes.
all cylinders before surgery, because that's how you get your best results. That's how you get fast healing. You don't have swelling that lingers for months and months and months because your body's already kind of optimized. When you go into it, and it's so many times I've experienced this with patients who come in for a consultation and they want to have surgery like as soon as possible, sometimes like as the next available surgery date. Okay. For whatever reason, if it's close by, people don't really realize what they're signing up for. And that's part of why I talk so much about what I talk about, because I don't want anybody to ever be surprised going into surgery and then come out and be like, oh my God, this is not what I was expecting at all. So it's very good. And I feel it's very good for us to be transparent about
Yes. Yes.
everything that has to do with plastic surgery, especially with
Correct.
incisions.
Correct. And I know it wasn't on the topic of our discussion today, but I'll just talk a little bit about it because of my own personal experience now. Another substance that we're going to have to start screening our patients and asking them about is actually semaglutide, so Ozempic.
Okay.
If you are on that medication, you need to hold it at least 4 weeks before surgery and at least 4 to 6 weeks after surgery, because the way the medication works is it causes you to not want to eat, right? It blunts your appetite. You need protein to heal. If you do not meet your daily protein intake and you have fresh surgical wounds, it is going to break down 100%. And through my own experience now, because so many patients are on Ozempic, and if they're dishonest, you too could have complications after surgery. And I know you don't want to stop the medication because you want to lose as much weight as you can leading up to your tummy tuck. And we get that as surgeons. But another thing that is also going to come further into light in plastic surgery is Ozempic and surgery and the dangers of using it all the way up until the point of surgery. And something that I want to start offering is nutrition optimization if you are on these medications prior to undergoing plastic surgery. Because again, I don't want to cause harm to my patients and I want them to be honest with me about the medications they take. So just another thing to be aware of is if you're on that medication and your doctor doesn't specifically ask you about it, please volunteer that information because it could negatively impact your results.
You know what? That's so interesting that you brought that up. And you're like the first surgeon that says we need to stop it because three surgeons prior to you have said just stay on it through surgery, no big deal. So
No.
this is really important. And this is why I do what I do, because these are the conversations that are being had in the office that, patients wouldn't know about until, years later. Oh, yeah, we've been talking about this for years. This is why I love having this platform, because it's important to hear different opinions,
Yes,
different point of views, different, like, this is happening over here, but this is happening over there. And it's so important. This is so important
it
because
is.
you brought up a very good point about nutrition. And you guys hear me talk about this all the time, not to go into calorie deficit after surgery because it's not good for you. It's not good for your incisions. It's not good for your fat transfer. It's not good for your tummy tuck. Like, do not go into calorie deficit. But if they're on
Correct.
Ozempic, it's going to be hard for them to meet their calorie requirements.
It causes a calorie deficit. It makes you not want to eat. It's an appetite suppressant. It slows down the speed at which food goes through your digestive system. So it makes you fuller faster. And so not only do you not want to eat, you eat a lot less. You eat a lot less. You're not going to get the nutrients you want. And I've had personal experience where a patient was on the medication and they had issues after surgery. And that's why now I have personal experience with it. I think it's going to become more commonly known. I think it is so new to plastic surgery that it is going to be a learning curve. I learned very quickly. And so, yes, Ozempic, have to stop it. I know once you get so many chefs in the kitchen, everyone has their own opinion. I speak from personal experience now that it is one of those substances that you have to stop.
And I'm so happy we're having this conversation.
Yes.
I
Yes,
really
I
am.
know.
I really am, because
Good.
this is the information I want for my girls. I want them to know these types of things so we can prevent them, because I have so many girls on Ozempic. Ozempic, Semaglutide, that other one, what's it called?
Manjaro.
Manjaro, whatever.
Yeah.
They're on all of them.
Yeah.
So up until right now, all of their surgeons have been like, yeah, go through until after surgery, you're fine. But now, and because of this conversation, and you are bringing this into my attention, 100%, you're 100% right. I know this is exactly what's going to happen. And I see it happening,
It
because
is.
I've had girls who are like, man, I am not hungry at all. I can see where this can be a problem for somebody who cannot force themselves to eat. Like, one of my
Correct.
girls told me that,
Correct.
because she's like, I'm forcing myself to eat because I'm not hungry.
Correct. So why would you put yourself in a position where you're not going to be optimizing your health before surgery?
So your recommendation is 1 month prior to surgery to stop semaglutide or
Yes.
whatever
Yes. Yeah.
brand.
Correct. Any of the diabetic weight loss supplements.
And then after surgery, 4 weeks.
4 to 6 weeks. Yeah. So like we discussed, after 6 weeks, your healing is at about 85%, and your body just starts, they're not laying down any more foundation of the healing. They're just changing type, immature collagen to mature collagen. So at that point, yeah, you're safe to resume the medication.
Awesome. Okay. One other thing about nicotine. So I remember being in a room with Dr. Mentz, and he was talking to a patient about smoking, and he was telling her 90 minutes after you smoke a cigarette, like, the surface of your skin is not receiving the appropriate blood flow. for 90 minutes after every cigarette, that the circulation is not at its fullest and like the surface of your skin is not getting what it needs.
Correct. Correct. So another thing, thank you, and I totally didn't mention this. So not only does the nicotine cause dysfunction of your clotting and wound healing cells, it causes your blood vessels to clamp down. So in order to heal, you have to get blood flow because the blood is what brings the wound healing cells and nutrients to the incision. So if you smoke, your blood vessels clot off, they get smaller, and again, you're not going to heal.
Same thing, different spelling. So it's the
Yes,
same thing, same, like your incisions are not going to heal at its full potential if you
correct.
are smoking.
Correct. 100%.
So that leads us to our next topic, which is THC and surgery. So, what's your opinion on THC as far as it could be smoking it, or if they're taking THC gummies, which a lot of girls are taking instead of pain medication, they're just taking
Correct.
THC gummies.
Correct. We are okay with THC gummies. I think it helps with postoperative nausea. I think it helps patients with pain. So if that works for you, we're okay with that. There's not a ton of great data showing that THC, inhaling it, inhibits wound healing. But if someone, it doesn't have as clear of a negative result on healing as nicotine does. But we're so conservative that we say, well, just to be safe, stop it. We're a lot less strict
Strict.
about THC smoking. So if you smoke once a week, like once like a month or like a couple times a month, like we're okay with that. I don't think it's going to have like devastating implications on your surgery.
Not like nicotine.
No,
Out
no.
of the three substances that we're talking about, alcohol, nicotine, and THC, the worst habit you could pick up or have around surgery time is smoking
Correct.
cigarettes.
Correct.
Nicotine, well, it doesn't even have to be cigarettes. It can be the vape,
Vape, if
the
it has nicotine, correct. It's not just the fact that it's a cigarette, it is the nicotine in the cigarette.
Okay, so the last thing I think we could cover would be like alcohol, salt, and swelling. So, salt and swelling, and kind of what to do to help with swelling.
So that's when nutrition comes really big into play. So the salt is filtered by your kidneys, and we pump you with a lot of fluids like in the operating room. We keep you hydrated. Your body initially doesn't know what to do with all that fluid. So it pushes it out into your soft tissues, and then it finally brings it back into your bloodstream. So limiting your sodium intake is going to help your body's ability to clear all the surgical fluid out without adding more fluid because of your diet. We know when you consume high salt foods, you're going to swell because your body retains more water. So it's going to make your healing take longer. You're going to feel swollen longer, and it's going to take more time to get your awesome result after surgery.
Dr. Abbasi, I'd really love to hear with your new training, because you're training, right? You're a new surgeon. What are you guys learning about post-op massage? Because I feel like it's changed. The industry has changed a lot about what to do after surgery with post-op care. And I'm really interested in knowing, like, what is it changing as what y'all are learning coming out of training?
100%. So in training, which is why I think it's so important for residents in plastic surgery to bite the bullet and do that extra year. It's really hard after 6 years of training to say, yeah, I'm going to do one more year. But
It's
you don't.
free, isn't it? Aren't y'all, isn't it y'all's the last fellowship is y'all are working for free?
No, no, no. We get paid.
Oh, you do
No,
get
we
paid.
get paid. Yes. Oh, that would be really hard because the cost of living in Houston is not very cheap.
I know. It's
No, we get paid previously, like several years ago. Yeah, it was unpaid because you want to do it. So a lot of places got away with not having to pay the surgeons because it's like you chose to do this, therefore we don't have to pay you. But no, now it's changed. because we operate here. And so we bring money into the practice. We help them advertise and market and all that. So we grow the brand that is ACPS as well as like getting the experience for myself. So no, we do get paid, but I didn't learn the importance of post-operative massaging or post-operative radio frequency treatments until I came to fellowship. So I would have never learned that in residency, because in residency, you're treating patients with cancer, treating patients with facial trauma, treating patients with handsaw injuries. You're taking care of patients with emergent needs for surgery. Maybe 1% of what you do in residency is cosmetic
Cosmetic.
surgery, right? So cash pay, no insurance. So you are doing yourself a disfavor. Like there's still so much in the realm of plastic surgery that's left to be learned. And I got to learn all of that in fellowship. And I'm still learning every day. I'm still learning every day.
I
But
love it.
post-operative massaging, critical, critical. It is so 85% of the work in surgery is done patient optimizing their nutrition, holding off substances, what the surgeon does in surgery. And then the other 15% is your compliance with postoperative care. And that includes wearing your compression, it includes doing lymphatic massages and low sodium diet.
What are your recommendations for how long they should keep their compression on? How soon can they start getting massages? What is for your patients? What are your recommendations?
So it depends on what operation they've had. If they have had a tummy tuck with lipo, I obviously don't want them starting the lymphatic massages right away. The reason is because that manual pressure can cause the incisions to kind of separate and open up. So if you've had a tummy tuck, you need to wait at least 4 weeks to have anyone touch your tummy. But you can still have someone start doing the massage on your back, bra line, and flanks like the day after surgery. So if you've had just liposuction, we want you starting the massages pretty immediately. And the reason being is because we know that cells that cause healing, they secrete collagen, and those cells don't like pressure. So when you're like putting pressure on these cells, you're stopping them from being able to lay down more collagen. And that's what causes fibrosis and excessive scar buildup after liposuction. It also helps retrain the fluid to go towards the lymphatics, which are the kind of the highway system for removing fluid from your body. So it helps in two ways.
I love it. I'm a big advocate for post-op care for massages after surgery. And it's really hard for me when I talk to my girls to give my recommendation because I always tell them, follow your doctor's orders. Your doctor is the one who, he's the boss or she's the boss. They're the ones who cut you open. So follow their orders. Whatever they say, that's what you do. If they're telling you not to do something, and this is why it's so important, and I tell my girls it's so important who you choose before surgery for you to know what is their post-op care like. Because if it's a post-op care that you don't align with, like if you have been online and you've been listening to the show and you know that you want to get massages after surgery, but the surgeon that you picked wants nothing to do with lymphatic massages. Maybe they had a bad experience, which happens. They have had a bad experience and then they're like, nope, no more massages on any of my patients. So as a patient, you would have to go against their orders and find somebody and do something against your doctor's orders. And if something happens, you're going to come back to your surgeon and he's going to be like, I told you not to do that. Or whatever the complication is. They're not going to be, I would maybe say like as understanding because you went off and
Right.
did something that they asked you not to do. But if you pick a
Correct.
surgeon and you know that their post-op care treatment plan includes lymphatic massages and that's what you want, you can be open and have an open conversation with your surgeon about this is what I'm having, or this is who I'm going to go to, or maybe they have recommendations of people that they use. So there's a
Yes.
lot of more open conversation with your surgeon. And that's what I want. I want you to have open conversations with your surgeon about what you're looking for, what you expect, what you've learned. They can answer all of your questions. They can debunk any myth that you've heard online.
Yes.
And I think all of that stuff is really important.
It is.
So I'm happy to always ask what is the surgeon who I'm featuring, like, what are your recommendations? Because I know my girls like to hear everybody's opinion, like, oh, well, this one wants us to start doing it as soon as possible. This one says wait 4 weeks. This one says don't do anything at all, don't touch it.
I think it's dependent on what surgery you've had. If you have an incision, like a long incision tummy tuck, I think you need to wait at least 4 weeks, just because that manual pressure can put extra stress and tension on your incision, and it could either cause the scar to widen or cause the incision to open up. So if you've had a tummy tuck, I would wait 4 weeks before you let anyone touch your tummy. If you've had liposuction alone, start lymphatic massages, the day after surgery. The risk is low, the benefit is high. So it's a no-brainer for us.
I love it. I love to hear that. I
Yeah.
think that's it, Dr. Abbassi. I think we covered all of the things that we were supposed to cover. Most importantly, alcohol, nicotine, THC, giving our girls some guidance as far as what they can expect when they are using these substances and around surgery time. I think we've covered it. Do you have anything
Yay.
you want to tell my girls? Or how about this? If you were talking to one of your best friends, your sister, your mom, and she's looking into having surgery, what's one recommendation that you would give her? Like, okay, go have surgery, but make sure that you do blank.
Feel comfortable with your surgeon.
I love
It
it.
is so important. And there are a lot of really great surgeons out there. I am amongst fantastic people and talents. And I can promise you, like everyone, for the most part, is going to do the best that they possibly can. But the importance of going to someone that you connect with, that you trust, that you feel comfortable with, that is almost as important as the surgical result. Because I might be really happy with my result, but I want my patient to tell me, you know what, I think this part kind of bothers me, or I kind of wish my incision was a little bit higher. There are still things that we can do. And I want to know that my patients are being honest with me, because I don't want to falsely be going home and thinking, man, I did an awesome job. Their surgery looks amazing. And then there might be something really small that's bothering them. And I think it's important that you feel comfortable being honest with your surgeon. But I think it's also like very reasonable to say, I know we all chase perfection, but perfection is such a dangerous word, especially in plastic surgery. So don't fixate on it being perfect. Being flawed is normal. Now, I'm not saying having like totally abnormal asymmetric results is okay, but in general, like I think you need to also be reasonable in terms of what you expect as a patient. And having a lifelong friendship and relationship with your surgeon, it goes a long way. And that starts with picking someone that you feel comfortable with, that you can be honest with. Because I
Connection
think
with.
it correct. And I think it'll make you even more happy with your result.
Absolutely. I could not agree more. Being honest and transparent with your surgeon is so important. I've had patients who recently she picked a surgeon and she was maybe like 90% happy with her result. There was a small little thing that was bothering her, but overall, like her surgeon was so attentive and so over the top to make sure that she's happy, that she's like, I know I picked the right surgeon because
Yes,
I mentioned this to him and he immediately offered how to take care of it. And now she's like, it was a very simple fix. And now I love my results. So it's
exactly.
something to the patient can be that something that bothers the surgeon can be like, that's an easy fix, we can fix that in the
Yes,
office, 30 minutes we'll be done and you'll be good. And it's just
correct.
about being open.
Exactly. Exactly. And you have to find that surgeon that you feel that, hey, I can mention that to. Because I know as a patient, you also don't want to seem ungrateful or unappreciative. And I've seen this in like my own practice. And it means the world to me when they feel comfortable saying, hey, this little thing bothers me. And just like that example, it's thankfully it was like a very easy fix in the office. And like they're ecstatic now. But it highlighted the importance to me that I want my patients to be honest.
Absolutely. I think we could not leave off on a better note. That was such a great
Yay!
ending, Dr. Abbasi. I have enjoyed having you on. You are such an
Likewise.
amazing talent. I'm
Thank you.
excited to see you grow and blossom and just blow up because I know it's coming. I
Thank
know it's
you.
coming.
Thank you.
So
So I'm actually headed to Tampa St. Pete area
I was going
after
to ask.
fellowship. Yes. So exciting news. Please stay tuned on exactly what those details entail, but I'm very excited. And if you have Florida girls that need love, please send them my way.
Absolutely. So where can my girls find you?
So I am on Instagram. My handle is surgery and stilettos. You can find me on there, and my website, it's going to be abbasiaesthetics.com. It's in the process of being built. That takes several months. But yes, and I just started Facebook. I didn't have Facebook beforehand, but you can find me under my name, Bahar Abbassi, and then I have a professional account, Bahar Abbassi MD.
I think you should get on TikTok. I bet you would do so good on TikTok with your
So
personality.
I have a TikTok. It took me so long to figure out how to make Instagram reels that I'm almost intimidated by TikTok because now I'm just like, oh my gosh, I have to learn like another platform. But I have it. It is the same name, Surgery and Stilettos. Maybe I'll start. Maybe you've inspired me
Maybe,
to.
maybe go on there. I think that your audience will really enjoy watching you through
Okay.
your day.
Oh, I appreciate that.
Okay, guys, I will see y'all next week. Thank you, Dr. Abbasi, for
Bye.
coming
Thanks,
on.
Mavi. Bye.
Bye.
If you enjoyed this episode, please go on Apple, write me a review. It's the best way for other women who are just like you, who need help, who are looking for information, valuable information on the internet. This is how they're going to find it. So go on Apple, give me a 5-star review if you love this podcast. If you want to support the podcast, the best way to support the podcast is through the website. If you need help through your journey, if you need help finding a surgeon, if you want to join the membership, if you're looking for Bruise Juice, you guys don't sleep on Bruise Juice. Y'all know I have my Bruise Juice 30 coupon code for y'all to use if you're having a BBL, if you're having liposuction, if you're having a tummy tuck, if you need to be using Bruise Juice all over your body. Stop using those other brands that are not tailored for your post-op recovery. Bruise Juice is formulated for your recovery. It's amazing. It nourishes your skin. It helps your fat transfer live. Don't sleep on Bruise Juice. Bruise Juice 30 is the code.
And don't forget, new episodes every Monday. I'll see you then.